first of all, I would really like to welcome everybody to Women, Young Children and COVID-19 Stories from Brazil, Eswatini, Palestine and South Africa. My name's Christina McMillan. I'm a Senior Research Fellow at the University of Edinburgh and one of the co-investigators on the project. And I'm just going to chair the session this afternoon, just kind of lead us through and introduce all of the speakers to you. So I just have a very, very quick couple of slides just as an introduction to what we're doing. So yeah, Karina, if I could get the next slide, that'd be great. So just a little bit of housekeeping before we start. We are recording the event. You know, obviously we want as many people as possible to be able to see it, so it will go on our website and people will be able to access it afterwards. Please use the chat now to introduce yourselves, but during the speakers, the chat's going to be switched off just so that we can all focus on what the speakers are saying, but the Q&A function will be open, and we'd really appreciate it if, as we go along, people could post any questions, any reflections, any responses to the presentations, and we'll have a decent amount of time at the end to come back to some of those questions. Obviously, you can do that at any point. If you do leave the meeting, it'll just take a moment to admit you back in. So just to be able to know that. We've got here for technical issues, please post a message in the chat. Actually, we're not keeping the chat on. So if there's a technical issue, do post a message in the Q&A. And we've got a few of our research team who are really keeping an eye on that Q&A. So we'll be able to sort that out, or hopefully be able to sort that out as quickly as possible. Thanks, Karina. So just a little bit about the project, and I'm going to whiz through this, but just give you some information so you can get in touch if you want to get in touch. This webinar is part of a research project called Safe, Inclusive, Participative Pedagogy, Improving Early Childhood Education in Fragile Contexts. And the research aims to identify and develop safe, inclusive, participative pedagogy that can be implemented in fragile contexts and is sustainable for governments, communities and families. So we work particularly, the project is kind of coordinated through the University of Edinburgh, but we work in Brazil, Eswatini, Palestine and South Africa have research teams in each of those countries, and you will meet our team later on this afternoon. It's a huge research project, and the approaches include analysis of early childhood education policy and systems, both at country levels and community levels, qualitative case studies, community case studies in the 4 countries that I mentioned, and that's using creative participatory methods with young children and their families and other key community members. And it's kind of from those case study areas that we're mostly going to be hearing this afternoon. A systematic literature review looking at developing the economic case for safe, inclusive pedagogy in early years education, and quite a large process of knowledge exchange, and that's part of what this webinar is today. Can I get the next one, Karina? Thanks. So just an overview. I'm not expecting you to take this in, but just wanted to kind of acknowledge all of our team members that we have from all of the different universities, and you'll hear a lot of these people speak later today, either in presentations or in Q&A at the end. And just the next slide, Karina. Thanks. And just, you know, if anybody is interested to find out more about the research project, either you're very welcome to email me, or at that web link there, you can get a little bit more information. So yeah, on to the next slide. That's enough about the project. So just a little bit about our program for today. So we have an opening presentation which we're just going to go into now, by advocate Salido Tipanyane, who's the CEO of the South African Human Rights Commission. Then we have presentations from the 4 partner countries, which is Brazil, Eswatini, Palestine and South Africa. Professor Kate Isdall is the principal investigator for the project, and she'll be listening to all the presentations and responding to them after the 4 presentations, and then at the end we have some time for discussion, and that's where your questions will really come in. So yeah, I'm just checking that there's nothing else that I wanted to say to you, which is really just about encouraging you to ask questions. And after each presentation, if we have time, we might have a couple of questions specific to that presentation or we might save them till the end, but we'll have plenty of time at the end for questions. So first of all, I'd like to introduce our keynote speaker, which is Advocate Sadido Tipinyane, who is the Chief Executive Officer of the South African Human Rights Commission and former Chief Executive Officer of the Safer South Africa Foundation. Sadido spent over 13 years in the SAHRC as head of research, mainly responsible for the monitoring of economic and social rights and access to information rights, before becoming the Chief Executive Officer. He is a former researcher on criminal justice at a huge range of universities, which there's a long list of here, and also has numerous publications on human rights issues and has presented conference papers in over 20 countries in Africa, Europe, America, and Asia. He was admitted as an advocate to the High Court of Lesotho and South Africa, and served on the project committee on child justice of the then South Africa Law Commission. So we are incredibly honoured to have Sadido here, and really looking forward to hear what he has to say this afternoon. So Karina, just for you, Sadido isn't going to be using slides, so we could maybe just turn the presentation off for this section. Thank you very much.
Thank you, Christina and colleagues. It is definitely a pleasure for me and an honor to be invited to this very important event, but also a very important topic, which is also quite close to my heart, issues of early childhood development and education. Last night I was just reflecting on my own personal stories about the significance and importance of early childhood. I left South Africa when I was about 5 years and went to Lesotho, and I was staying with some relatives there. So basically, I had no developmental assistance at all as far as early childhood. I went to school at the age of 5. For 2 years, I didn't even know how to read. And when I went to grade 1, actually, I failed. I was put at the back of the class. It's only when I caught up later. And I'm contrasting this with my son, who was quite fortunate that he was born by a father who was a CEO. So basically, he grew up in relative privilege, going to schools, private schools in New York, in South Africa, and the difference really. And for me, it's quite sad that we're still not investing adequately in early childhood. I come from the child rights world movement, where the theories and the principles are very clear that the world tomorrow is shaped by how we raise children today, whether they become good citizens or bad people, whether they become productive or not. And yet, despite this, we are still not, investing adequately in early childhood, especially, in low-income countries, but also even in wealthy countries. There's still a gap between the rich and the poor, and therefore this basically, shapes our countries, our societies today. As they say, violence begets violence. So if children are raised up in environments which are not conducive, then we do see many of the challenges we are seeing today all over the world. Now, in the context of our discussions today, the impact of COVID-19, clearly COVID-19 has had a major impact on rights, but also more on women and children, especially those who come from marginalized societies. We are seeing our economies faltering. We are seeing challenges around service delivery, and of course, it's always again the poor, the women and children who suffer. And so, in the way, then COVID-19 has also exposed the many fault lines in our societies, the gap between the haves and the not and have-nots, but also, the greater impact again on early childhood. I'm just looking now at my own country where people have been staying at home, and we're seeing lots of, reports around abuses in the home, but also, due to lockdown, children are not free, to basically, grow up in that space, be able to play around. And so the psychological impacts also of COVID-19 are quite devastating, especially on early childhood, where nowadays children spend a lot more time basically looking at gadgets, TVs, and tablets, and really not growing in a proper manner. So a lot really has to be done around this. But on the other hand, also, COVID-19 has also, emphasized another very important issue about the connections between all of us all over the world, that what happens in one part of the world also affects, the other parts of the world. So in this sense, then it is also, an important opportunity of reflections, but also a rallying call to say that, if we really want to make the world a better place, even for our children, there is need really for greater interconnection of efforts in making sure that, we do create a conducive environment. So in this sense, then the project is quite important, and the partners who are involved in this project actually, highlight this importance of us working together to ensure that we do a lot more on child rights issues and a lot more on early childhood development. Now, my commission has also been trying to do work on this area. We are now celebrating 25 years of our existence, and we've just signed an agreement with UNICEF to really, do a lot more around issues of children. We also have a think tank in South Africa, which also includes a number of organizations, including Lizette's people and government departments, to basically try and again, put as a top priority the issues of COVID-19 and its impact on children, but also how we can better, advance children's issues. Now, the second part, of course, of this project is really about giving a space, for stories to be shared on how COVID-19 is affecting human rights, is affecting child rights, is impacting on early childhood. And then I think, also just going back to the point I raised earlier on about, the devastation of COVID-19 on our economies. We're seeing major problems in this regard. Like in my country, as an example, where, due to the economic challenges, government hasn't got enough monies anymore to basically give effect to socio-economic rights, including child rights. And we're seeing the impact of this. So again, this is an issue which has to be addressed. So, the stories around the impact of COVID-19 become quite important and significant for us, to have a greater appreciation, of the challenges around this area and what needs to be done by all of us in this regard. So in this sense, then I really appreciate the project, and I'm sure we'll work with our colleagues in South Africa to see how also we as a Human Rights Commission can assist more in this project of putting greater emphasis on issues of early childhood. In my country, there are thousands and thousands of young children who don't have proper early childhood education. And this is also seen, for example, in the outcomes at high levels in primary schools, at high schools, where we still have very, very high levels of failure rate. I'm told only about 60% of children who get into the educational system actually graduate at high school. It's even also worse at university. And this also shows then the importance really of pedagogy around issues of early childhood and the need for us to work more. So the stories and the outcome of this project should definitely make a contribution in bringing greater awareness and also influence greater commitment from all of us as government, as institutions like the Human Rights Commission, to support the initiative around advancing early childhood. So I really want to thank you for this opportunity and wish you all the best in your project and the discussions today. Thank you.
Sadiso, thank you so much. I think the messages that you bring to the webinar will be reflected across all 4 of the contexts that we're working in, and we really appreciate both your presence and setting the context for us today. So thank you so much. We're going to move on now to our presentations from our country partners, and the countries are in alphabetical order. So we're going to start with Brazil. And presenting for Brazil, we have Irene Rizzini and Carolina Terra. So Irene is professor at the Catholic University of Rio de Janeiro. She's president of the International Center for Research and Policy on Childhood in Rio de Janeiro. And Carolina Terra is a social worker and a junior researcher at CIESPI, which is the same international center in Rio de Janeiro. So I'm going to hand over to Irene and Carolina, and really looking forward to hearing what you have to say. Thank you.
Thank you, Christina. It's a great pleasure to be here today. I would like to thank our partners at the University of Edinburgh for this opportunity, to our partners in South Africa, Eswatini and Palestine, to all those involved in our project in the 4 countries, particularly our community residents and all the children. Our most sincere desire that they will truly benefit from our collective work. We do it with love. So we will get started with our presentation today, which I'll be sharing with Carolina. The next, Karina. So here's the content of our presentation this morning. Very briefly, some basic facts about our community, early childhood in Brazil, and COVID. The views of COVID from the children, and then the final part, some issues from the consultations with our community, Rocinha, about COVID and women, and the voices from women from that community. And finally, how we think this project can assist the community. It has a little delay, Karina. So to start with, we have to say that we work in a community that is really large, over 100,000 inhabitants, residents in this community. It's a slum area in the city of Rio de Janeiro, with a mix of Black, brown, and white residents. A community affected by a lack of basic sanitation. Only 65% of Rio homes have effective sanitation disposal. Home floor plans can be really small, about 3 square meters, and with a number of stores, lots of family members living together. Lots of health challenges. Overcrowding is one of them, resulting in poor ventilation, lack of sun, high rates of infectious diseases, and such as HIV/AIDS, tuberculosis, and leprosy. Very much affected by violence, especially from drug traffickers, vigilante militias, and confrontation with the police, resulting in gun violence. And a vigorous family run small business life, and the proximity of middle-class neighborhoods, as I'll show you in the photograph coming, provide access to such jobs as bus drivers for men and domestics for women. Next, please.
So here, it's grateful to be here with you. You are hearing? Yes?
Yes, we can hear you.
Okay, thank you. So here are some basic facts about early childhood in Brazil. There are almost 18.5 million children 0 to 5 years old in Brazil, and about 1,300,000 in Rio de Janeiro. Infant mortality rates per live births, 58 per 100.
We are
Live, Irene? So reduced it to 12.2 in 2020. So 48.2% of white children living in homes with serious structural problems compared to 67.5% of Black or brown children. 30.9% of children 0 to 3 attended in creches, and 84.4% of children aged 4 and 5 attended preschool. Next, please. So the view on COVID from the children of Brazil. These sentences were taken from a video that shows 3 children throughout Brazil drawing about and commenting on how COVID has impacted their lives. CIESPI was pleased to play a major role in both starting the Circle of Actions, Ciranda de Ações in Portuguese, in the National Coalition on Early Childhood, and producing the video. So here are some general reactions, the children general reactions. I hate the pandemic. Sad, many people in our family are dying. No one can touch anyone. And about missing in school. If everyone dies, I want to be able to go to school. It's so awful because we have to spend so much time on the computer to do our classes, but it's also good because we can spend so much time with our families and some hope for the future. I want everyone to be well. I want the world to change, and for only love to be inside it. And I want people to understand that the world is equal and that everyone is like everyone else. Next, please. So, some data about COVID in Brazil. As June 8th, 2021, almost 17,037,000 cases in Brazil, with almost 477,000 deaths. Currently, there are almost 53,000 new cases reported, with almost 3,400. Cases are hurting is studied at very high peak, but numbers of deaths is declining. Brazil has first-rate vaccination recorded thanks to its public health system, but it's suffering from shortage of vaccine, partly due to the genocidal decisions of President Bolsonaro. 2 research institutes in São Paulo and Rio de Janeiro are now making vaccines under license from other countries. Next, please.
So I'm back, Carolina, okay? So
okay.
I move on. I don't know what happened, but these things happen all the time. So here we can see that half of the families in low-income communities in Rio are headed by women, and COVID has added much to their already hard lives. 86% of them have difficulty affording basic food products. The second largest occupation for women in Brazil is domestic work. And the closure of creches in preschools, which happened in last March this year, meant that many women had to give up work and hence the family income. Violence was endemic in the community before COVID-19. Our consultations with the community have found accelerated domestic violence in the community experienced by young people and their families during COVID. Next, Karina. So we have in the consultation many challenges related to our daycare centers, as the residents do count on these centers, physical challenges, professional challenges, also fiscal challenges, which are slow and inadequate payments from the municipality, giving the directors really a huge challenge in maintaining those places open. Also difficulty figuring out how to work with parents in a mutually respecting manner. Next, please, Karina. So here are some testimonies, and I'm almost ending this presentation. This is really important and came through our interviews with women in the community. So they express very well the hardship of these days. So they say, one of them, I keep thinking about my aunt who is working throughout this period, but who is caring for her children. I'm also talking about a baby 2 years old who is being cared for by a sister who is only 15 years old. My husband is unemployed and we don't have food in the house. The church is helping me with money to pay the bills. They help me with food. They help me with all kinds of ways. I feel a miracle. And I have these people to help me. But what about those people who have no one? There are single mothers who are renters, and from the moment they began to be late with the rent, they began to despair. The pandemic has caused big changes in the routines of my family. My 10-year-old daughter is being cared for by her father who is unemployed. I work in the health area, and initially we suffered a lot because of social distance, because of risk of infection. We didn't have conflicts because of this. However, it is I who have the responsibility for all the organizational arrangements of the home, and there is an overload on me. We keep listening from them about the overload on their shoulders. I can see that the pandemic caused reflections and some changes in the posture of families, but it did not overcome machismo. And our last slide, next one, Karina. So we finally have been exploring with our community how this project can help them, can support them in their struggles, particularly looking at early childhood education. And our first strategy is to work with our community advisory board and other community residents to develop strategies to support the community with changes on early childhood education. So here are some of the issues that we have been hearing from them. First of all, the mental health of children is a big concern. So one strategy that they have been suggesting is to find materials and struggles to assist teachers and parents. The other one is the difficulty centers have in working with parents. So the suggestion about having sessions between the two groups in a neutral setting with neutral facilitators. Another idea is to facilitate a WhatsApp conversation group with parents wanting to talk about their children's education and development in general. And finally, we found a little bit at the beginning, to our surprise, that all these conversations with the community, they started telling us that they felt really good about it because they felt quite isolated and they wanted more contact. So here is also our plan to find ways to maintain interaction and more systematic contact with several groups in the community and work with them on strategies to make young children really a priority in the community, discuss their rights and their development. And the last one here, I just have our Next one, Karina, is our website. For those who are interested, thank you very much. Do we still have time for something? Did we respect the time, Christina?
Irene, you were wonderful.
Easy.
As always, you were perfect, to the point that Mohammed sent a message saying, we trust Irene that she's tying up just now. So, so if there are one or two kind of specific questions for Irene and Carolina about Brazil and about the research in Brazil, then we'd be very happy to take them now, or we can save them to the end. But I just wanted to comment on those quotes from children, Irene, how heartbreaking some of them are.
While we wait, if I have 1 minute, can you show that picture again, the pictures, Karina, because something happened to my internet connection, and I really wanted to show you here. This is how active the daily lives of these people are. This slum area is in a hill, as Rio de Janeiro is very hilly. And so you can see here on one side you have, here's the most amazing ocean, the most amazing view. And one side here you have the slum area with over 100,000 people living. And then you have the asphalt separating them from this very high income community, obviously in front of the beach. We call this the Belinda, which is, you know, the PIB of income from India and on this side, and from Belgium on the other side. And in this photo here, you can see also the contrast between the way all these houses are, so the density of the population, how they live. So it's really amazing. I usually say, and our university is located right in this community. We say, you know, a child being born on this side of the asphalt, or that other side of the asphalt, might have the same dreams, but they have very different lives.
Thank you so much, Irene. That's it's amazing how much the photos bring the reality to life, isn't it? I really appreciate that. And I think what we will do is move on now to the presentation from Eswatini, but we'll hold any questions that come till the end. So thank you so much to Irene and Carolina. Incredibly powerful presentation. And we're now going to move on to the presentation from our partners in Eswatini. So we have a presentation from Ms. Nomsa Dlamini. I really hope I've said that correctly, Nomsa, who is the Acting Director of the Eswatini National Trust Commission. So welcome, Nomsa, and we look forward to hearing what you have to say. Thank you. And I'm hoping that the technicalities are going to work correctly. Nomsa, are you there? Let me see. Here we go.
Yes, she is. Let me just check and ensure that the mic is on.
Yeah, I've just asked to unmute, because I don't know, Nomsa, if you can hear us, but at the moment you are muted. Are you getting any response, Clement?
I'm calling. Please unmute your mic, Magase. It's your second one.
Oh, the joy of webinars, and how quickly we're all learning to use this new communication method.
Okay, maybe just a question from, get some questions from Irene for a minute. She's trying to connect again.
Okay, so I'm just looking to see if we have questions. what we could do maybe, if Rabab would be happy, is move on to the presentation from Palestine, and then we can come back to Eswatini, if that's okay, Rabab. Is Rabab there?
Yes, I'm just trying to fix the camera. I'm sorry.
No problem at all.
Yeah.
So stepping in at last moment to change the order around a little bit, we have our presentation from Palestine. So Rabab Tamish, who is the assistant professor at Bethlehem University and a co-investigator on the project, is going to present from Palestine. Thank you, Rabab. Thank you for being flexible.
No.
We can see you.
And my pajama, particularly for this event.
Oh.
You need to unmute speaker. Okay. Shall we start? Yeah. Hello.
Yes, we can hear you. Do you want the next slide? Is that?
Yeah, okay. Hi, everybody. Thanks for hosting us today. Ahmed and I have prepared this presentation, but it's me who will speak. Ahmed decided that when Palestinian women are around, it's better for men to step aside. So welcome, everybody. In our short presentation, we'll focus how our engagement in one of the case studies that this project involves in, how we managed to find some reason for life within this difficult situation, especially when, as most of the audience, I assume, know that the political situation in Palestine is not as the rest of the world. Palestine, unfortunately, is still the only state on earth, on the world, that's still under occupation according to the international law, despite that there is what we call the Palestinian Authority in some parts of Palestine, 9% of the land. We still believe that the full ownership of Palestinians on their daily life and freedom doesn't mean that human rights regulations. So we will not repeat what is already available about how COVID. I'm sorry, there is someone needs to be unmuted. Yeah.
I think we have a bit of a crossover, Rabab, with Nomsa. Nomsa is now muted. Rabab, I wonder if there is something over your microphone, though, because you're a little bit unclear and it sounds a little bit like there's maybe something over the microphone.
Can you hear me now better?
Much better. Thank you so much.
So you either hear me or see me. So I will go for hearing me. So what we are trying to understand is, within this political situation in Palestine, as you even witnessed in the last 2 weeks of increased aggression on all areas in Palestine, including, particularly Gaza, Jerusalem, Palestinians within Israel, and the West Bank. So during, COVID, in addition, COVID, what happened, we have the same symptoms of what happened in the rest of the world in terms of closure and distance, increasing number of infected people. The occupation itself was another barrier, if it wasn't worse than the corona, in terms of how it internalized somehow different realities about Palestinians as already marginalized and already disconnected from the rest of the world. And the COVID increased such a burden on our daily life. So can you move to the second slide, please? So in our work with the community, we were trying to answer two main questions. thinking about how participatory pedagogies can be implemented, and if it works within the critical time of COVID, and also how children and young women in such a marginalized area are coping and finding meaning within the challenge of living under occupation and with the limited resources to access to help during the COVID. Next, please. So our work is in a village called Masara. It is within Bethlehem area. We started with this village. First of all, it has a very limited number of population. It's 1,000 something. The number is not accurate for political reasons. Some people, according to the Israeli law, if they live in West Bank and they have a Jerusalem identity, they might lose their residence. So the number of population is never accurate in any of Palestinian areas. But within this, based on what people and the community provided us and the official records in the Ministry of Statistics, that there are so far 550 children, 200 of them under age 4. The area is surrounded by settlement, and it is under the threat of losing more lands than what they are having now. Most of the people are depending on agriculture and working within factors and different, working class work within Israel and within the cities surrounding Bethlehem. What is critical about this area is that it is a community where there are another 5 villages surrounding them, and the whole area is really in crucial needs for resources, facilities, and lacks of activities, even especially addressing to children, because there is only one kindergarten in the whole place, and there is no nursery for children below 5. Next, please. So we believe that as in general, Palestinians cannot accept reality as it is. This is what made us under fighting all the time our political oppression, social and economic. And so within this community, we started when the COVID already started. We started to think together, so how we can work together. And so the process was, for our action research, was based on, as we expect, building a rapport with the community. And we had some of our already students who studied at Bethlehem University working in the community. So we started to build such a relationship with the community. The community is very cautious about having externals, especially when most of the project that their experience with external intervention was always about short-term activities where people could come, do some activities and leave. So within this interaction and using different tools about what people need, what they think about children within this community, we developed some needs assessment that was built with engaging the community itself. So there was like small committee from parents and children and youth who were together, started to ask other people and bring information, and we started to study together the needs of the village. Of course, we use different tools such as drama activities, drawing, and as well as a drama role play with parents to encourage them to think about what can be done for children within their daily lives, and particularly when marginalization is increased during this period. And then during that, it's created that people mention that one of the challenges that they need a place where children can and parents together have a sense of community and where they can learn together about learning. So our main approach through this process is about that adults and children, they learn together. So the community center, as you see, It was donated by the community. Some external donors, they helped at the rehabilitation only with no equipment. And suddenly the whole community started to prepare it as a place for hosting activities. And there was a call for the wider community in Palestine to donate to the center. And it was managed to bring different tools and different activities for children within. And during that process, we established also that our approach to community engagement is that where people can think for themselves, and it is, as anybody who engage in critical pedagogies can understand how difficult to tell people let's think together, and they assume that we, the expert, can think better for them. So the process is taking a lot of dialogue, open dialogue, and different ways of frustration and misunderstanding. But it always led to learning how people can make decisions about their daily life and about children's needs. So far, the place was, next slide, please. The place was organized, and where children decided where the places should be done, where they want a reading corner, and they choose the colors. We were hoping to take them to the places where they can decide, but we didn't manage due to COVID. So through drawings and picture, they decided on everything, and they were interested in a lot of science activities. So students coming and doing some activities with the children, and parents can reflect after each activity. We sit together and we say, what we learn about your children through this engagement. So we are at the beginning, and we hope by the end of the project, there will be more accounts about how learning could happen within marginalized area, where parents could regain their image as influential in their children's life, and to learn that children can do things rather than to perceive them as passive learners in the process. So we hope through the documentation of the process to highlight in 2 years how children became leaders and fully active and critically engage in designing their informal learning life. Thank you.
Thank you so much, Rabab. I just find the work that you're doing in Palestine incredibly inspirational, and particularly that photo on the left-hand side of that slide just really speaks to me. I remember you describing the community centre before any of the work was done, and one of the things I really remember is you saying about like not even having any furniture that was at child height, and so to see the bookshelves and see the bright colours of the tables and chairs is just yeah, I was really moved when I saw that photo. So thank you so much for your presentation. I think what we will do, if it's okay with you, is move on to the next presentation and then come back to questions at the end, if that's okay, just because, yeah, there's a couple of different questions coming in for different teams. So, yeah, okay, thank you so much. I'm going to check to see whether Nomsa, whether you are able to come on to go back to the Eswatini presentation. Is that, are you there? Can you hear me?
Yes.
Yes, I am.
Perfect. Nomsa, lovely to hear you and see you. So I'm going to introduce Nomsa Dlamini, who is the acting director of the Eswatini National Trust Commission. Thank you for sticking with us and for working through the technical difficulties. I really appreciate that. So yeah. I will hand over to you now. Thank you.
Yeah, welcome, Christina, and all. Thank you. Okay.
Nomsa, we are having some problems with the video freezing. So
in my presentation, I want you to do in the past. It was in the past. where, sorry?
I think we have a delay, but I'm just saying we have some problem with your video freezing. So I wonder if the same as with Rabab, it might be better for you to turn the video off, because sometimes that works a little bit better, and then come back on at the end to see people. Is that okay?
Yes.
Yes.
Thank you.
Okay. Our education used to have a formal and informal education for both boys and girls. It used to be conducted in the traditional homestead, where there is an enclosure for women and for men. Women play an important role in teaching children a way of life in communities. So that's what they used to happen. And the boys are on the men's enclosure, where they make fireplace and sit there. Their grandfather and their mother, their father, they are there, and they learn over there. There are so many things that they learn. They are separated according to their gender. So as they are separated, that is when the females are going to learn how to take care of themselves. Next slide. So according to their growth, the boys are given titles. The babies, a toddler, a boy, when he's called a boy, when he's separated according to gender, it is when now the child is able to express himself, is able to talk everything about himself when he enters school, because when he's still young, he cannot talk, and it was considered that he cannot be able to, maybe he may not live up to 5 years. So after 5 years, then the gender is separated according to the way I have stated there, and that makes it easy for them to know that at this stage, this is what is happening. For example, the children, when they get into the stage of being a toddler between 3 and 5, they leave their mother's hut and go and stay in their grandmother's hut, where they are going to get bedtime stories from the grandmother, and so on and so on. This was happening before we got this formal education for going to school, the school education. And this school education has encouraged us to stick to our cultures, because we could see what we are supposed to do when we are at school, and we separated it from what we are supposed to learn at home. So this education has always been there. The education that we had in the past, it is there even now. So in Eswatini, we are carrying it out together with the now education. Can I go to the next slide? Okay. I hope you appreciate the pictures of the growth of the children according to their stages. Next slide. Next slide. So, okay. Or maybe as we are here in the pictures, I can explain about the traditional homestead, that it is built according to a way that it separates the girls from the boys and their activities too. Their activities the girls' activities includes constructing the windbreakers, liguma, as we can see them on the bottom slide at the bottom, and this one on the right. So that if you see the enclosure made out of the reed, it means it is for women. It is an enclosure for women. And then if you see this one that is made out of logs, it means it is an enclosure for men, young and old. And there's this enclosure right at the front of the huts, just before the crawl, where you can find the men seated there. They are taught different things. It has been happening before. In some homesteads, it's still happening even today, where you find these children, the boys, girls, they are learning. There are factors, however, that have affected these activities. It is the migration of the parents from the rural areas to towns to seek for jobs, in a quest to get something to eat and to teach their children, to pay for their school fees. It is also, it has also been affected, the education has been affected because this pandemic has caused a lot of disturbance. With the parents dying, the children have remained alone, and there is nothing the children can do. The disease, the pandemic, the virus has been declared a disaster in the country. And with that, the children do get food, but it is not enough because they have been locked down from going to school. From even now, as they have gone back to school, the schools are not, the program is not normal, it's not as normal. So all these restrictions for movement has caused a lot of disturbances. Next slide. Okay, I have explained this too. Can I go to the next slide? Okay, the teachings include ways of behaving and ways of participating in activities that are taking place in the community and in the nation, at national level. For example, boys have a certain shrub that they cut every year during one of the sacred ceremonies, where they cut this shrub, and that is a passage for them to go through adulthood, from being a young man into being an older man, to be an adult. So for them to know that they are Swati, they are Emaswati, they have to go through this passage where they will end up grown like older men, participating activities that are now for men. Can I get the next slide? The education today is expecting parents to teach their children at home. And as they are doing that, you find that some of the things the teachers, the parents, they do not know these things. So it frustrates the education. Some of the activities that are supposed to teach the children, which are cultural, they are washing away because they cannot practice them as their parents do not practice them, especially using these tangible, tangible objects like the wooden dishes. They cannot get them. Some of them do not know them. Those who are staying in the townships, they are different in as far as cultural practice is concerned with those who are in the rural areas, because they are not cognizant of these objects. However, they have to learn about it. Can I have the next slide? The next slide, please. This is the development. Can I have the picture over there before this slide? So this is what is happening now. The children are going to school. This is what I've already explained, maybe. Can we go to the next slide? I have also explained this one, that they are moving from the rural areas into towns to get money for funding for their children. Can I go to the last slide? Okay, the other one before the conclusion. The COVID-19 has also caused the young ones, children as young as 15, to take care for the young ones. You find that a child is taking care of a baby because of the situation. And the level of poverty is also increasing because of this, of the fact that the child is not moving forward with regards to education, is now taking care of these children. So she will remain there without anything to support herself with regards to growing socially and economically. Also, there is this pregnancy issue where you find that these children during this era of COVID-19, they're getting pregnant. The boys are impregnating the young girls, and the young girls go also to older men to look for money. Even the young boys, they also go to older women in search for money. So that causes a havoc in the homestead. You find that all the children now have babies, are pregnant with babies. Next slide. In conclusion, I can say that we need to, in Swaziland, we have a challenge that every member of the society should strengthen and reinforce early education, because it was working out for the society, regardless of the fact that there were deaths and pandemics such as COVID-19 and other pandemics. But they used to push forward, they used to have a life because they used to practice this culture. So if in Swaziland we can reinforce, in Eswatini we can reinforce the early education, and maybe even other communities or communities globally can do that. It can work for them.
Thank you so much, Nomsa. That was an absolutely fascinating presentation, and I feel like I've really learned a lot, particularly about the difference in education between the genders. That's absolutely fascinating, and yeah, I think your conclusion will fit across a lot of the different contexts that we're learning about today. So, thank you so much for your presentation. And we're going to move on now to the last of our country presentations, which is from South Africa. I will ask people to bear with us with the technology just a little bit. Hopefully it will all run wonderfully smoothly, but this one is a little bit more complex technologically, so fingers crossed. From South Africa, we have Lee Morrison, who is the project director with True North. I'm expecting that Lee will maybe tell us a little bit more about True North as an introduction to the presentation, and Nonyumeko Lerula, who is a social work auxiliary worker. Yeah, so welcome to both of you. Thank you so much for taking part, and fingers crossed for technology, and yeah, looking forward to your presentation. Thank you so much.
Thank you, Christina. Yeah, so I would just like to say hello to everyone, and I really appreciate the opportunity to be here today. And I'd like to start by introducing the community of Vrygrond. So if you go to the next slide, we can get an idea of where Vrygrond is situated. So Vrygrond is, of course, in South Africa and down in the south of Cape Town, very near to a popular surf spot called Muizenberg. And the community of Vrygrond was originally created by trek fishermen in the 1920s, and it's historically one of the oldest communities in Cape Town. And yeah, they erected very informal shacks so that near the beach, so that they could be close to work. And Vrygrond is still a very informal community. It lacks sufficient basic services such as housing and water and sanitation. If you go to the next slide, the community members often feel forgotten, and they believe that their voices are not heard. So in the next slide, you can imagine that there's a lot of frustration coming from the community. This photo is a photo of a peaceful protest, and at these particular traffic lights, protests are quite frequent, and they're usually peaceful, but there are times where they're not so peaceful. And if you look to the right of the traffic lights, there is a beautiful suburb called Marina de Gama, and then to the left, you enter into Vrygrond. So this is a really good example of the geographic separation of population groups that happened during apartheid, and we still live with those consequences. So the next slide shows you Marina de Gama, and then the next slide shows us Vrygrond. This photo is an area in Vrygrond called Overcome Heights, and Overcome Heights is the most informal part of Vrygrond. Vrygrond as a whole is less than 1 square kilometer of land, and an estimated 44,000 people live in Vrygrond. Out of that 44,000 people, 5,000 are children under the age of 5. Prevalent social ills in Vrygrond include unemployment, gang-related crime, teenage pregnancies, substance abuse, and domestic violence. And the next photo shows us the community center situated in the middle of Vrygrond. This is a center where some NGOs like True North and others, as well as community projects, provide various services to the community. we generally try to work together to coordinate services as to not duplicate. And the struggles in Vrygrond are very real. If you go to the next slide, I just want to mention that Vrygrond is a very vibrant community, and it is incredibly diverse. And there, in that diversity, there's a real general respect for each other's cultures. This photo shows a local food, chisanyama, which is on offer every day and always served on the side of the road. What really amazes me and inspires me about the many people that I've met in Vrygrond and come to know is how they manage to rise above and to move through extreme situations and then still show love and compassion and generosity to others. If we go to the next slide, just to talk about COVID-19, and we felt in South Africa, we did really feel the impact of COVID-19. We had different levels of lockdown regulations. From the 26th of March, we went into lockdown level 5, which was the most restrictive level of lockdown and meant that we all had to stay home. The only people that could move around were essential services. And this lasted for 35 days. And what we're going to hear now are 2 stories that will give you all a real insight into how this situation was experienced in Vrygrond. So the first story is from a mom and just how she experienced COVID-19 and the lockdown. And then the second one is from a principal of a preschool, and she's also a mom. And thank you to Nyami for being the voice of these two next presentations. So enjoy the story.
When the pandemic came, it hit hard. It was bad in Vrygrond, but I am proud we didn't have so much cases. It never went above 30. People did behave, they were disciplined, but we only had a short time to educate the community. That you have to sit at home, wear a mask. We weren't allowed to go around because of the country's regulations. We shared on WhatsApp groups. Though we had few deaths, it was very sad, especially the unemployment part. People started losing jobs. Even before COVID, we had people who were deprived of food support, and now with this, it becomes worse. In this deprived community, I would say 70% of people are backyard dwellers, renting on other people's land. Some landlords didn't understand, and community members started losing their homes as well. So they had to go and occupy the open land at the back of Vrygrond, the land called Xakabantu, which has no water and sanitation services. Children had to go and relieve themselves in the bush. They are in danger. A young girl of 6 or 7. There may be someone waiting for these kids. You know, we have those men who are wicked. It was heartbreaking to be a parent at that time. Growing up, my mother taught me that even in struggle, there will be a way out. But in the pandemic, there might not be any way out. The child would say, I want food, and the solution I have now is to give this child a glass of water. You understand, just to prevent the thirst, the hunger.
That's just that line.
And having a child who keeps on nagging because he can't have what he is used to. It is trauma, it is depression. No money for electricity, you would sit in the dark with your child. Getting sick, you can't go to the clinic. The only time the child can go to the clinic is when there is a serious problem. But now he is coughing. Maybe or there is something wrong. So there is something wrong and you can't take him. At least I still had a salary. Other people didn't, and some didn't even have the grants. I was receiving calls that said, I don't even have a bag of porridge. It was traumatic, too much. I saw young children eating from a dump site, scratching in the dump. They would wait for the truck and take everything just to make sure that their stomach at least had something. Vrygrond United for Change, a group of people from our neighboring communities, came with a feeding initiative. There was an existing soup kitchen, but they couldn't feed the whole community. So we established a map so that each and every street in the community has a reachable kitchen. There are those people who sleep outside, but we were able to reach them too. As a parent, normal life was waking up, bathing the child and getting ready to go to school. Now he's losing education. You have to become a teacher yourself, making sure that he could still count. He could still sing, spell out words. Luckily, schools created a WhatsApp group and sent stuff that children should be doing. But some parents can't read themselves, and now you are being sent activities. Maybe you don't even have WhatsApp. When children could go to school once or twice a week and the parent goes to work, the child might go back home because the school told the child, it's not your day today. This parent may not have had WhatsApp and had to stand at the gate of the school to find out when the child should come and when not to come. Communication wasn't so clear. So that's for a working parent. But there were parents at home. This parent got nothing and facing a time of not being able to pay rent, and the landlords not going to understand and chase them away because they also rely on the income. Step number 2, she fails to buy food, fails to buy electricity, fails to do what she used to do to fight for this child. Everything just comes at you. You are weak, you are losing as a parent. You fail to make a 4-year-old or 5-year-old child understand. That's the kind of cases we had. Normally in Vrygrond, you had some people waking up at 5 to go and beg to find food. They used to go to our neighboring communities and be given a piece of bread at one house. The next one gives you rice and so on. But with lockdown, they couldn't. They were stuck in the house that has nothing to eat, totally dry. Even though we had few deaths, the traumas and depression it caused on those houses. A community is nothing without a woman and a child, especially a woman. She gives birth and she needs to see that the child grows. But that child can't grow when that child lives in a community with nothing that makes the child grow. This is a community where people are going through trauma for the rest of their lives, when little things could have prevented it. If only people out there could understand and listen to our stories. When they say we are closing on 26 March, we thought it would be a short thing and we would open in April. But it was like a bomb in our lives because we did close for a very long time without any money, without any budget or any savings in our ECDs. It was a hectic thing. That year was like I am seeing the hell in my life. No food for my kids. I had a little baby at that time. Nappies was something I was struggling with. It was really stressing me. I had to go for credit for the food I needed for the baby. I overspent and went to the loan shark people. You will pay back double then. My own staff members were so stressed. The rent needed to be paid, money for food. I couldn't continue to pay them. Parents were asking us for food for their kids. The main thing we saw while the children were at home was the kids going to queue up for food at the soup kitchen. The children stood in queues and parents directed them with their small containers. It was 2 times a day. The ECD centers, we all were shut down. When you hear the president is going to speak, we know it's another 2 weeks. Now we accept COVID is real. We don't have money. We just sit like that until we get through North and NGOs giving us food for the parents in July. The Lunchbox Fund came to give parents food boxes twice. so kids could get porridge to eat at home. Some of the stuff I would give to my teachers. We were so happy to get boxes with food. I was concerned about the children's health. I sent messages to parents not to let them play outside and to wash their hands. Then through North sent us messages and videos for the parents so they can play with the kids, eat healthily, how to wash hands. This was helping us last year. And we sent schoolwork to keep them busy. Some of the parents sent us pictures of what they were doing. Some they wrote to say that they are doing the math stuff, sorting bottle tops, empty boxes, helping wash potatoes, asking their child, how many potatoes do you have? How many tomatoes? I said, wow, this was helping. In lockdown level 3, we could start some jobs. My husband bought vegetables to sell at the side of the road to get some money for bread. Then in August, they said we could now open our ECTs. Now we are relying on parent fees. True North is helping us by getting some people to help us with salaries. The amount of children in my center is less. Then the money is not enough. I had 46 children and now I have 23 regulars. Some ECTs closed and some said they would open this year and they didn't even open. Some have 6, some have 15 children. It's a sad thing. Most parents are keeping the children at home rather than giving them to the corona. They are not working every day, so they keep them home and they can't afford to pay school fees. I think it would be better if they are in the ECD center. They would be safer indoors, not running up and down. And we wash hands at the center. COVID is not going to go now. We must try to use the small things we get wisely. We pray for a funder who can sponsor us or fix our building or sponsor some salaries.
Wow, thank you so much. What a powerful presentation. Lee, is there anything else you want to say at the end? Sorry, I'm coming in.
No, that's absolutely fine. Just thank you everyone for just taking your time this afternoon to hear the stories. And yeah, it really hits my heart hard when I hear it, even though I've heard it plenty of times. It never fails to really hurt actually to hear the level of struggle, you know.
Absolutely. Yeah. And there's something incredibly powerful about hearing it from people's, you know, in people's own words and their own stories. Exactly. Yeah, absolutely. Yeah. Thank you so much. So we've heard from all of our 4 partner countries and what incredible presentations, and so powerful and so different, and we really appreciate that. And now I'm going to introduce Professor Kay Tisdall, who is the principal investigator with the project and is chair of childhood policy at University of Edinburgh. Kay has been hearing the presentations for the first time, just like all of us, and now she has the incredibly difficult task of making some comments and maybe some observations about the themes that cut across these presentations. So yeah, over to you, Kay. I'm very interested to hear your thoughts.
Well, that's a challenge, Christina, but actually I want to start with thank you. So thank you to yourself, Christina. I thank you. There's a whole group who have helped organize the webinar today. Karina and Alice are making sure the technology works. Wonderful contributors. And then just to mention the funder, the UKRI and ESRC as part of the Global Challenges Fund. So a huge thank you, and really sort of colleagues and friends to be sharing some ideas with you and see where they can go further in our discussion shortly. And I just was really struck and thought maybe the start was, you know, when our first speaker used those 2 words, fault lines and connections, and that just really led me to thinking things and sort of structuring my remarks now. it almost feels like a familiar narrative, perhaps, now that we're over a year into the COVID-19 pandemic, to suggest that the pandemic has caused particular pressures for us, but also it has perhaps revealed and deepened fault lines. And across the presentations, several of those really came out for me, from that comment about a child asking for food and what was offered was a glass of water, about those really fundamental issues about unemployment, food insecurity and poverty, and social economic issues, about access or not being able to access services. Namusa's dimensions of gender, that just really came out from that presentation, violence and more. So these fault lines that we knew we'd had, but perhaps have been revealed and deepened during COVID-19. But I was really struck by the narratives that we're hearing and how they seem to ring for me in terms of ideas of space, from almost literally, again, the fault lines of that peaceful protest that we saw, to hearing about the restrictions in terms of households, missing spaces for children outside, and very core to our project, these spaces for early childhood learning. And that brings me and starts to bring me into the potential for connections. I've always thought the human geography concept of space was so useful. I'm not a human geographer, so I think it's actually just such a great concept that really brings together, doesn't it, about recognizing the materiality or physicality of environments, but also how that works with relational. And that we were seeing also examples of that, perhaps instigated, inspired, or in response to the COVID-19, from the space that was found in the community center, where children and parents in the community could come together, that we saw the opportunities of the kitchens in the very latest South African contribution, and about the importance of that. But I'm also sort of struck by that quote from the Brazilian presentation, what about the people who have no one? And that's really, I suppose, where the project will be wanting to go ahead. You may know it, but maybe just to say up front, the project was instigated far before we were thinking about COVID-19, but we found ourselves in the midst of it quite early on. And for all of us, I presume it has been extraordinary times, but equally I was reading an article, and in a very profound and complicated way, they sort of presented an idea of the predictability of unpredictability. You know, that actually, you know, is there real learning in the extraordinariness of what we're doing about, as it reveals some issues and some concepts and some ways forward for us. And I think just to say at the end, we debated a lot, I think, within the team about, you know, did we need to change the project and change the big questions we were hoping to ask about safe, inclusive, participative pedagogy? And I think the conclusion was that actually those ideas were perhaps even more important and showing their importance in terms of early childhood learning and early childhood of our project, and that it was actually only more important to be learning and supporting and working with the children, their families, the people in their communities. So that's, I think, what our ambition is, and we really look forward to hearing all of your ideas. Thank you, Christina. Over to you.
Thank you so much, Kay. That is, yeah, fantastic to hear. And I just think, yeah, just so powerful. I don't have more words, and I'm really happy to open the webinar up for questions now. We have a few questions in the chat, and we have a few questions that people have emailed direct. But if anybody wants to put more questions in the chat, that's you're very welcome to do that now. And we have all of the co-Is, or not quite all, a lot of the co-Is from the project, the co-investigators from the project are on the call. So it may be the presenters who take your questions, but if any of the other investigators, any of the other researchers who are involved in the project would like to answer any questions, that's absolutely fine too. And what I would do is say, if you want to come in, if you could just switch your camera on, if that's possible. just makes it a little bit easier for myself and Mohammed and Marlies and Karina, who are keeping an eye on the questions and on who's around. I wonder, do we still have Tecido on the call? Yes, we do. So Tecido, we have a initial question for you, which came up when you were giving your initial presentation, and I think it's a fascinating question. It's from Lucy Curry, and she said, thank you for your insightful talk. You give an interesting contrast between your humble early upbringing and that of your privileged son. And she wonders what you attribute your success to. So quite a personal question, and I hope you're okay with me kind of asking that on the call, but I wonder if you have any comments that you'd like to make to that.
Yeah. Well, I would say partly due to luck, being in the right place at the right time, but also I think, well, some talents on my part. After failing, I realized that you know, I can work harder, and I've been doing quite well. And I managed to get a scholarship for almost my entire university education, my BSc, my LLM, and my LLB. So basically, I guess I wouldn't be where I am today if I had not, if it had not been of the kindness of people who were able to sponsor my entire university education, largely the UN, whilst I was in Lesotho. But also, I think the support of my parents, even though they were poor, but they were always urging us to make the best out of our lives. Unfortunately, in the family of 4 boys, I was the only one who managed to go to university. So, you know, it's still a big problem in our country. And this is why I'm saying, you know, for me, it is a concern that, you know, in our country, almost, you know, we have a high levels of poverty and inequalities in our country. Almost 70% of the African community in our country lives in poverty. So there are millions. As you saw during the presentation, there are millions of South Africans who live in formal settlements, and therefore for them, honestly, getting a proper childhood education, it's a pipe dream. And this is what actually maintains the growing gaps between the rich and the poor in our country, and therefore also affecting many issues, you know, in terms of human rights, stability of our countries, including development and progress. And therefore, there's a need really for all of us, really, if we believe in universal realization of human rights, that we do need to take a stand and urge all our governments to do better. Our countries have enough resources. If there was proper management and proper distribution of these resources, then every child will be able to have a decent early childhood education. Thanks.
Thank you so much. Thank you, appreciated. And I suppose what I do want to say as well is that although some of these questions are kind of directed at particular people, if anybody else has anything that they'd like to say, please do come in, because we're very interested in kind of observations across all the different contexts as well. Thank you. If there's, I don't see anyone else turning their camera on though, so I am going to go on to another question for the Brazilian team. So Irene, Carolina, maybe you might want to kind of start with this one, which is, hello to the Brazil team. Thank you very much for such an insightful presentation. One of your last points was about how the community reacted positively to using a group on WhatsApp as a communication method. And I think a couple of the different presentations mentioned WhatsApp as a great way of communicating with communities. And the question is, with all the problems of privacy and misinformation spreading on WhatsApp, would it be ethical to encourage its use? So a question about ethics and maybe the challenges of different ways of communicating, particularly in times of the pandemic. Irene, would you like to come in?
Yeah, sure. This question came from Taman Kuran from Palestine. Thank you for the question. We, over the years, have had several discussions with the community about technology, what to use, what not to use, especially because there is a very active drug trade business in the community, and we have to be careful so that they don't use these channels for other purposes. And so we don't do a thing without them coming with the idea and telling us what has worked and how safe it is for the residents. So that's first thing that we have to be very careful. So this idea really came from our team, our project team. We have 2 people in our team who are residents of this community. So really were born there. So they really know the community very well. And the idea is to use it with basically with the advisory group, and maybe for some focus groups in discussing, for example, early education for the children with parents and issues of their interest. So only those people who would be invited to participate would have access to that WhatsApp, and there's no way we can use it for like everyone for networking, which is a pity. We had that idea before with other groups, but we ended up concluding that that would be dangerous, including for the CIESPI team to be in such a group if the group would be really large and open. So we are going to experiment with whatever our staff members say it is safe for them and for all those involved.
And I would like to add something that in Brazil, WhatsApp is the most popular communication app. And despite the problems that you have mentioned, we believe it's a powerful tool too. So despite those problems, it's really powerful, especially in the pandemic.
Thank you, Carolina. Thank you, Irene. I wonder if anybody else from any of the other, anyone else in the team would like to come in and comment on WhatsApp in other contexts. I hate the unnaturalness, if that's a word, of Zoom, where you have to kind of wait to see if anybody's going to come in, but I'm sensing.
That's an interesting question. Yeah, I would also like to see whether in Eswatini or South Africa or Palestine, if that is, those ethical issues are also raised, or whether this is a possibility. We, Christina, in our team, we have been discussing in our project creative methodologies to work with people in the community during the pandemic. And also our group came with the idea of having parents with young children in short videos, and then that would not be necessarily a conversation, but like our South African partners used, small videos showing the interaction between parents or other family members and the babies, especially very young children. And we think that there are lots of potential there if we are very careful and work really with ethical principles all the time.
Thank you, Irene, and really interesting discussions to be had there about the challenges between academic methods and methods that are most useful working with communities, right?
Mm-hmm.
Okay, let's move on to another question. So we have a question from Kay here, which is to all of the teams, which is to all of to the whole team, which is about Kay says she'd be interested to know how COVID-19 and its repercussions have emphasized and changed and added to issues of safety and violence within households and for communities, particularly households with young children. And has COVID-19 only underlined what we think about safety and violence, or has it changed it at all? And I don't know whether anybody would like to take that question.
I can come in.
Okay, wonderful. Thank you, Clement.
Because Nomusa just left, so she can't drive. It's getting dark, so she has to drive. I think from the context of Eswatini, definitely there's been an effect in terms of safety generally within first the household, regarding the general safety of our children. And we've also seen an escalation in domestic violence, which is exposing our children also to the impact of this violence on themselves and also on their families. And it has actually disrupted the peace in families, because people are not used to spending like 24 hours together, you know, with minimal visitation to the shops and other things. So it has had an effect. And also it has an effect, like generally I'll speak about my kids. When they step out of the house, they insist on wearing a mask, even if there's no need for them to do it, because there is this uncertainty around infections. They are very uncomfortable with visitors. They actually are the ones that manage who comes in, and if you come in without a mask, they don't allow you to come into the house. So you can see, you can have there's a sense of apprehension around safety and COVID safety and general safety in our families. And we actually have seen an escalation also in the number of people that are being arrested or convicted for some of these domestic crimes. So it has had actually an effect in our settings and has affected our children.
Christina?
Sorry, I'm muted, but would anybody like to come in from any of the other countries?
Christina, I think I will just connect this case question with a question coming from Marlies, because I think they are connected. Marlies asks, she was intrigued by the testimony of a woman we interviewed in the community, saying that the pandemic has not helped to overcome machismo. And so the question is, has COVID exacerbated of gender inequalities, like division of labor, child rearing, or there are some openings for change? It's a very interesting question. We have been hearing about the increase of violence in the domestic space due to overcrowding, due to a lot of people having to spend many, many hours in the home every day. And it is quite possible that tensions between couples in terms of gender expected roles, division of labor in the home, particularly cleaning, cooking, and taking care of the children, that usually is, these are activities mostly taken by women, that became a form of increase in the violence between especially men against women. Remember our figure that half of the households in the community in Hosting are headed by women. So that also tells something about difficulties or challenges that they have in terms of having a partner and raising the children together. So violence is very much part of the everyday life of those communities. And I think now, despite the fact that people are also scared of dying, not only because of like lost bullets, as they used to say, gun violence by the police, traffickers, now they are very much worried about dying of COVID and having the children infected. It is, I think, another aspect of the challenges that they are facing in a moment where many of them are unemployed, and they also have to struggle with food insecurity. So I think, yeah, I think that answers it.
Thank you, Irene. I wonder if Rabab would like to come in, or Ahmed would like to come in, just in terms of thinking about violence in the pandemic. I wonder whether there are things that you would like to contribute to that, or indeed from South Africa. We have quite a few representatives from South Africa to list all of you.
Yeah, Nyami and I were just chatting now, and you know, I think that what the pandemic has done is it's highlighted what has always existed. So there's that highlighting of it, but also exasperated it. In Vrygrond in particular, there's high rates of unemployment, and then to increase those rates even more, like Nyami was saying, is that people start drinking. And then that often leads to more violence in the home. We've seen in the community of Vrygrond an increase of general violence in the community. And then also just speaking to different women in the community, what I've also heard is that men have become depressed. And so women are actually taking up more of the role in the home. So they're trying to make sure, like we heard in the story, that children have food, but also that my husband is okay. So it's almost like burdened the woman with even more responsibility. And so, yeah, so there's that violence and depression on both sides.
Mm-hmm. Mm-hmm. And sounds very similar to what Irene was saying in terms of that link between violence and machismo. Yeah. Rabab, I saw that you unmuted your microphone. Did you want to come in?
Yes, I mean, I think it's becoming international issue, the domestic violence, and there are also from Palestine.
Rabab, can I ask you to turn your video off again? I'm so sorry. We'd love to be able to see you and hear you, but thank you.
Hear me now. Can you hear me?
So much better.
I tried my best. What I'm saying that yes, I mean, domestic violence now, reports from all over the world is showing it's not particular to specific countries, but I mean, Ahmed and I, we were trying to understand from at least the community we are engaged is what the pandemic is uncovering. You know, there were, you know, many things there, but the corona uncovered different realities about, first of all, what it means to invest in child learning. You know, when parents now they can hear what the teacher is talking to their child, it's rebuilding a new reality about engagement in children's learning. For instance, this wasn't before. I mean, teachers were inviting parents, come talk to us, and so how children, what we can learn from that about children when they are supervised by their parents, hearing what they learn through online teaching, and how parents and school are communicating. Some children we interviewed, they expressed how unhappy they are. They find it as oppressive way because they become more dependent on their parents, and they have to play the games to keep the pressure less than before. And also the expectation from parents. I mean, parents now, it's one of the concerns in Palestine that they become teachers and learning the material, and they are knocking on the doors of everybody in order to learn something to help them to support their children learning. So it's not only about, you know, the obvious expectation from people sitting in their homes cannot go, so there is some increased violence, but it also, I think there will be a lot of studies to think about the structure of families, how things are held, how children are approached, how children are, you know, some children, they talked about a new game that parents created during the pandemic. And this says something. Parents didn't know the power of what they are doing. Even in the village where we are, you know, in general, poor communities, they dream of what the rich have. And they forgot that sometimes they have such rich resources that they never also learn about it. So being in the field, sitting, collecting leaves, doing science with children in outside their homes, this wasn't in their daily image as a powerful learning tools. Only when they start to talk about it. They used to do it before, but they never knew that this is investing in children learning, because they thought that internet, games, being in music courses, this what will say that their children are learning. But when they started to recreate a new relationship with the resources, the natural resources around them, it also tells us something about appreciating the indigenous experiences that people are creating, and they don't know about their powerful. And so I think what we need also to explore how people are creating, more than crying about the reality, but how they are coping. The coping strategies are the concern now, more than, oh, yes, we don't have money, we cannot go. Yes, this is, I agree, but this, we hear about it now. We need to learn how people are coping. This is the power. Thank you.
I can see so many people wanting to come in, and also we have 4 minutes left. So I kind of feel like that is such a wonderful place to leave it in terms of that positivity for the future, because I feel like a lot of what we've heard today has been difficult to hear, and a lot of extremely difficult experiences, but also that hope and that wanting to engage, and the role that our project can play in that. So I kind of finished the webinar feeling a lot of hope, even though we've been hearing some difficult words and difficult stories.
No,
I
Christina,
apologize.
I just
Irene
have
needs
to
to speak.
add.
He needs to speak.
I just have to add very quickly. Remember, in the video we showed about children expressing their views about COVID. One child says it's all very sad. We lost people in the family. She's very young, and she said, but also I have mommy and daddy at home with me.
What a wonderful point to end on, Irene. Thank you so much to everybody who has presented. Thank you to Sediso for such a wonderful presentation at the beginning, to all of our presenters. It's such a fantastic research team on this project, and I really appreciate being a part of that team. So thank you to all of you, to Kay, and also to the kind of the behind the scenes technical team who have been kind of squirreling away, working out all the presentations and the webinar software and all of those things. As Irene pointed out, I forgot to thank our funders at the beginning of the webinar. So a thank you to the Economic and Social Research Council, who fund us through the Global Research Challenges. No, Research Global, well, GCRF. my mind is a little bit scrambled just now, but yeah, really appreciative to everybody, and I hope that you have enjoyed the webinar and learned something, and please do get in touch with us if there's any of these conversations that you'd like to continue. Unfortunately, we didn't manage to get through all of the questions, so thank you.